A penetrating keratoplasty, also known as a PKP, is a full thickness transplant of your cornea. Your cornea is the clear windshield in the front of your eye. It's made of 5 to 6 layers. A deep anterior lamellar keratoplasty, or DALK, is a procedure where we remove all the layers except the bottom endothelial layer. So that's like a 99% full thickness transplant. Whether we go with one or the other really depends on how healthy the innermost or endothelial layer is. When I meet with you, I will discuss which transplant could be best for you and which one could give you the best post-op result. And which one you qualify for based on whether you've had previous trauma, if there was an infection that went all the way through the cornea, whether you have a dystrophy or degeneration, or whether previous surgery caused the scarring or opacification of the cornea. The real reasons we undergo corneal transplantation of almost 99% thickness or full thickness is because there's some sort of scar or really, really serious shape change in the cornea. So we will analyze your cornea using a tomography and see how much light passes through it and see what the overall shape is. We also analyze to see what is the best vision that your eye can give us. So if I do change the cornea or the windshield and I place a new cornea in, or like changing the windshield on your car, how well can you see? So we need to look at all these parameters. We need to look at the risk factors that you might have: age, whether you have high blood pressure, whether you're on blood thinners, whether you've had previous surgery, whether you have diabetes. There's a lot of risk factors that we evaluate to see if this surgery is effective for you, whether it's safe for you, and whether we can together get a great result. Overall, the chance of this surgery going well for you is well over 95%. But doing the surgery is the first part of it. There is a follow-up and post-op period. And so when I do this surgery, I remove your cornea, take a cornea from somebody who's passed away, and I place it into your eye. I do sutures around the outside, usually 16 stitches, and those stitches can stay in for the rest of your life. However, I will see you on the first day after surgery, and then I'll see you 1 week later. And then I will see you in consecutive months, so 1 month, and then another month, and another month. Around the 3-month mark, we look at how your cornea and the new cornea have healed. Then I start cutting the stitches. When I cut the stitches, I can change the shape. By changing the shape, we can improve your vision. It's kind of like taking the warp out of a windshield. To do those stitches properly, the Pentacam test is needed monthly to measure the surface changes on the surface of the eye. Once we get a pretty great shape, which means low astigmatism, and we can keep the clarity of it, then we'll switch over to glasses or contact lenses.